What is the AMA's position here? Are you in
Well,
favor of?
believe...
Do you like? Let me just ask it this way: are you in favor of? Do you like the idea of a government-sponsored health insurance program?
Well, clearly our principles are for. The principle is we believe that in America, to have universal access for health care for everyone, we have to preserve freedom of choice, freedom of the ability for physicians to practice in an environment that they think is important for their patients. And we believe that we should have a pluralistic system. That's an American system. That means a private system and a public system working together to try and say what's good in both systems, let's make those better, and what flaws can we get rid of that are in the private system and the public system to, again, focus on what's important. Every American having affordable quality health insurance coverage with the ability for choice of their physician and the hospital they go to.
Now, Dr. Rohak, Tony asked you if you were for a government-sponsored health insurance option. This is what President Obama wants to do. Very recently, the AMA has said in print very clearly, we don't think this is the best way to handle this situation. But then you just told Tony that you're for it. So I'm confused. Can you clarify it for us?
Well, clearly we have been around for 160 years, and we write and respond to things in print over those decades. Where we are right now is to say we want to make sure that there's choice. And so, for example, our AMA policy says there's a federal employee health benefit program right now that's government-sponsored. It provides choice of options. It's the same benefit practice that the Congress has. Well, if it's good enough for Congress, why shouldn't it be good enough for the individuals who don't have health insurance provided by their employer? It provides the pooling mechanism, it provides choice, it provides the ability of the government to help subsidize based on a person's income level, and you don't have to waste administratively by creating something brand new.
Well, James, James, forgive me here. Look, I'm not the sharpest tool in the box here, but, you know, Elizabeth mentioned that you've written that you're not in favor of it. I think I hear you switching that view. Look, another position that's been pretty clearly stated by your organization is a belief that a public plan would drive out private insurers. Now, do you actually believe that? Is that a rumor that is now false? Is that a line that's been tagged to the AMA that is absolutely inaccurate? Help us with this point.
Sure. What we were responding to was a position paper that the Senate Finance Committee came out and said one option was to have a Medicare program for everyone. And our response to that was, well, you know, Medicare is going broke. And it's a system that, while it's a government system, if you're going to make that as your focus to expand everything, if you're someone over the age of 65 and you are moving to a new community, you'll find that many primary care physicians can't accept you into their practice anymore because of the way that that federal system pays for health care. They've never covered their cost, and so it becomes very difficult for us to say, well, gee, that's the system that's going to have affordable health care coverage. Everybody has choice. Everybody has the ability to buy in. We believe that there's a better system, and that system is to make sure that we can build on what's good in our current system and to get rid of the bad. So do we say that a public
what's bad? What's bad?
Private...
What's bad? What's bad? What do we get rid of as we sort of whittle away at this? What's bad?
Well,
what do we keep and what's bad?
We know there's administrative wastes that every insurance company has their own forms. And so why can't we just have one form?
Well, why haven't we done it yet? I mean, we've been talking about this for years and years and years, and it seems as though whenever we get to talking about reform, that's the first thing we hear is we can do with less of this paperwork. But we've been talking about that, Doctor. Am I wrong in this for years?
No, we're talking about
Tony, I think you highlight very well. One of the problems we have is when physicians try to get together or private insurance tries to get together, the federal government's antitrust lawyers come in and they say, oh, you can't talk to each other. And so as a result, we have a very fragmented system. In fact, we don't even have a system. And that's one of the reasons why the AMA pushed for having health information technology so that we can link together as physicians with hospitals to try and get rid of the unnecessary costs of duplication of tests, so that the patient, when they see the physician, that physician has all the information they need to provide better care for the patient at the time that they're being seen. We've been supportive of that. We're happy that the federal government, through the president in the stimulus package, provided those dollars. So we are committed as the American Medical Association to evolve our healthcare system to one that preserves choice, freedom, but most importantly, everyone has affordable health insurance coverage that they own themselves.
Elizabeth, jump in here.
So, Dr. Rohak, it sounds like you're saying that now the American Medical Association is in favor of President Obama's plan to have a government-sponsored health care insurance out there that any American could choose. What do your members think about this? Because there is a very good chance that under this plan, they would stand to make less money.
What we said was we are supportive of a principle that says we have pluralism and a principle that preserves choice, freedom of practice, and something that we can do to get rid of the administrative waste. We are for looking at any option that's out there, and I think that's been one of the challenges that we've had, is there's been a lot of rhetoric of, well, what is a public plan? And so what we've focused on is to say, well, if you have choice and you have the ability to purchase based on your needs, there already exists a system called the Federal Employee Health Benefit Program. Congress has it, federal employees have it. Why not allow individuals to purchase into that system that already exists? It would be less costly because you wouldn't have to create a whole brand new system. So that's our AMA policy. We've had that for a
Doctor,
while.
if you were sitting in a room with President Obama and he said, Dr. Rohak, tell me, are you with me or are you not? Are you with me on this plan to have a government-sponsored health insurance option out there? Yes or no? What would you say to the president?
Some kind of government-sponsored option out there, Doctor.
We are for whatever we can achieve, which is affordable health insurance coverage for all Americans that preserves the freedom of choice, a pluralistic system, the ability for physicians to practice in the environment they want, and everybody's covered. And any plan that comes out, we're going to be looking at that and we're going to say, is it right for patients? Is it going to allow the patients to choose and have access to their physicians? Because we have examples of federal programs like Medicaid where their access to physicians and hospitals is very difficult because of the way of the payment system doesn't even cover your ability to keep your office open. So what we want to do is have something that works for patients and make sure that, again, we build on the strengths of our system and we get rid of the waste and the inefficiencies of the current system that we currently have.
Okay, we're building. It's incremental. We're building a bridge here. Doctor, thanks for your time.